Live from Utah's first TV station, ABC4 Utah. News at 4 starts now.
Up next, it's Prostate Cancer Awareness Week. Find out why new technology and treatments are less invasive than ever. Thanks, Dan. Prostate cancer is the #1 cancer killer of Utah men, but early detection and new technology could save the lives of thousands. Ogden Clinic urologist Dr. Stevenson joins us now to talk about Prostate Awareness Week that's happening right now. So when we talk about prostate cancer, we know that early detection is key, just like with most cancers. Sure. But it's the blood test and the examination, and some men walk in and say, what, I'm only here because my wife told me to come?
Right, that happens to be the instance in a lot of cases, and listen to your wives, men, if that's the case, because it's good for you.
So what all goes into that screening process, and at what age should a man come in and see you?
Right, so the screening process, even though it sounds a little bit uncomfortable, and maybe is a little uncomfortable, it's definitely worth it. Men at an average risk starting around 50 or 55 years old should be coming in to see me or a urologist to get screened. And that includes a physical exam, which is included as the digital rectal exam, which is the one that the guys kind of dread.
That's a little bit one, though. That's the uncomfortable one that people know about.
That's the uncomfortable one, yes,
okay.
That's right. And then a blood test. So
yeah.
Overall, not too bad, given the benefit you could get from it.
Okay, speaking as a woman who has to go through womanly checks all the time, it's not the end of the world right. What you guys have to do just that once.
Exactly.
So what are you looking for? What will tell you that person likely has cancer?
So with the physical exam, we're looking for anything that feels abnormal about the prostate. A normal prostate, if you take your hand and feel this part of the thumb, that's kind of what a prostate should feel like.
Okay.
Anything that's hard makes us suspicious. And then the blood level, the test is called PSA, stands for prostate-specific antigen. And basically it's a chemical that the prostate makes normally, and prostate cancer can make that elevated. So that's what we check for in the blood.
So this is something that a man should definitely come in, get checked when they hit that certain age. Does family history play a factor if your dad or your uncle had this?
It does. It plays a huge factor. In fact, the screening age changes if you have a family history.
Okay.
And so guys who have a brother or a dad with prostate cancer should be coming in at 40 years old, 40 to 45 years old.
So 10 years or so older than someone without that family history.
Right.
This is something that can spread very quickly, not a lot of symptoms until it has spread. So how key is that coming in, finding it early, and treating it early? Right.
So prostate cancer is what's called an indolent cancer. It grows over time, and the symptoms aren't great. And so by the time you have symptoms, the cancer is probably too far advanced to be cured from. That's why screening is so important, because if we catch it early, you can cure it.
We know that we have come a long way in the medical field in just the last 5-10 years when it comes to cancer research, treatment, detection. What have we learned about prostate cancer, and what are we using to keep more men alive?
Right, so prostate cancer, again, like I said, is a slow-growing cancer for the most part, but there is more aggressive cancer, and that's kind of where the research is kind of ferreting out what cancer is going to kill you, a man, and what cancer is going to not affect you as much. As far as treatment options go, it used to be if you wanted to treat your prostate cancer, it would require a big surgery. You're in the hospital for several days. Now there are other options for prostate cancer. There's a robotic surgery, which has a much faster recovery time. You can get radiation treatment. And for low-grade cancer, there's what we call active surveillance, which is basically just following the cancer and making sure it's not spreading, and you could potentially avoid treatment altogether.
So you might have prostate cancer, but that doesn't mean that you're necessarily going to have that treatment and have to deal with that down the road. Well, Dr. Stevenson, thank you for coming on the show today, chatting with us about Prostate Awareness Week. It's Prostate Cancer Awareness Month. There's the information on your screen right now to Ogden Clinic. We also have more details on our website at goodforutah.com. Thanks for being here.
Thank you.
Coming up after